All right, thank you, Jamie. And perhaps we'll have some time at the end and we'll finish before and we'll have plenty of time. So as Jamie was mentioning before we get started today, I wanted to remind you about some of the other upcoming webinars. As he mentioned, you can see a list on this screen. And again, these are from 11 until noon, unless otherwise noted. They are free. So definitely tune in for some of these upcoming. You can find those at our website. So my name is John Frazer, and I am the manager of industrial hygiene and occupational safety and health at West Virginia University's Industrial Extension. I am a certified safety professional, and I've been working with the Industrial Extension team for 23 years. During my time, I've helped manufacturers identify hazards and educate workers, and have provided expertise to reduce occupational exposures in the workplace. I'm over in Hampshire County in the Eastern Panhandle, if you're familiar with that area. And more specifically, my office is in Romney, West Virginia. And I am responsible for outreach across the state. As far as safety and health projects are concerned, we work across the state. So with that said, I want to talk a little bit about the industrial extension. And we partner with small and medium-sized manufacturers in West Virginia to support operational improvement and business growth. As part of West Virginia University, the industrial extension serves the university's land grant mission and is housed in the Statler College of Engineering and Mineral Resources. As West Virginia's affiliate to the NIST MEP National Network, the WVU Industrial Extension is part of that nationwide program of centers tasked with supporting the manufacturing community, which many of you are part of on this webinar. This unique arrangement provides the industrial extension the opportunity to support manufacturing community from a national, state, and a local level. We focus on developing consulting services that reflect client needs. So we provide hands-on education. We work one-on-one with our clients to deliver practical solutions in the area of workforce, as you see on the slide, occupational health and safety, management systems, operational improvement, advanced manufacturing, leadership development, and innovation and growth services. So I'd like to get started. And we want to get started with what we're all here to learn. And I'd like to welcome you to this webinar titled OSHA Log Requirements, Taking the Guesswork Out of OSHA Record Keeping. And I say, well, almost, right? Yes, there are a lot of gray areas out there with record keeping. And for safety, for that matter, record keeping can be confusing in terms of what we need to record or not record. So I don't claim to have all the answers to every record keeping scenario, but I am familiar with the 1904 record keeping standard. And I also know who to call with a record keeping scenario that I can't give you a definitive answer for. So, if the questions come up and we can't answer them today, we will definitely follow up with it. Also, I want to make mention in the beginning that the OSHA Log 300 is not a workers' compensation form. So we won't be discussing anything to do with workers' compensation topics today. First off, I'd like to take a poll question here. And I want to know how many of you have completed or posted your OSHA Form 300A. And I also want you to keep in mind, and I know some people are already answering, but keep in mind that these polls are anonymous. We are not going to turn anyone into OSHA. We're not going to report that you didn't report. So, is your OSHA 300A form complete? Is it signed? Is it posted where your workers congregate? And we got about 71% of you say yes. Now, some of you who are saying no may be exempt, and we're going to talk about some exemptions, but some of you aren't familiar with the 300A, and that's fine as well. We're going to talk about it today. So thank you for that. Let me see, I'll close that. And again, these polls are anonymous. We're not collecting any data, so feel free to answer them how you like. And really the breaking news is you should have already posted your 300A form. and you should have submitted electronically if requested. So first, we know that you have to post this OSHA 300 form A. This is our annual summary form. And it has to be, it takes all your logs and all your injuries and illnesses, and it basically puts it onto one sheet. This needs to be posted where employees congregate, where you post any type of employment information from February 1st until April 30th. So that summary form should be posted at your location right now if you're required to do record keeping. Second, if you're required to submit it electronically, it was due 2 days ago on March 2nd. And again, electronically, that means OSHA has sent you a letter, whether you're exempt or not, and asked for the data. Yeah, so what happens if you haven't already posted this, or if you're required to submit electronically and you haven't submitted? Well, we recommend that you do it as soon as possible. It's always better to be late than never. And I think a plan of action would be this. In fact, if you're not exempt and you haven't yet completed your 300A, these are the things you should do. So we want to review every entry on your OSHA 300 log from last year, which would be 2020. And we want to make sure that all that information is complete and accurate. And then we want to create an annual summary of injuries and illnesses using the 300A form. That's the one you're going to post. It's a summary of that 300 log. And then we need to certify the 300A form. And that's with a signature from an executive or an equivalent individual. And we'll talk a little bit more about that. And then finally, we want to post that completed and certified form, that 300A, in a spot where your employees congregate. Again, where they're going to see normal postings. I would note, because I do see this from time to time when we go out and do mock OSHA inspections and we're out on company sites, I see that companies have cited the 300A between February and April, but sometimes those postings would be altered or defaced, or most of the time it's covered by other material. So they sort of fill up the bulletin board with something else and covers that paperwork. The other thing to remember is we have to retain this information, these different forms that we're going to talk about. And I'm going to repeat this over and over, but for a minimum of 5 years. So you can post the 300 log, you can post it with the summary form if you want. A lot of companies do that. But again, if that area could be accessible by others, like members of the public, we want to make sure that we remove or hide any names on the 300 log, all the identifiers, things like that, so that people outside the workplace can't see it. So that's our plan of action. All right, so the urgent news out of the way. We know we need some postings done. And if you haven't done it, that's something to work on. I'd like to spend the remaining amount of time talking about the following ideas. We're going to talk about the background of the record keeping standard, give you a little history on it. We're going to talk about how we comply with OSHA's record keeping standard. We're going to actually look at the forms, the 300, the 300A, and the 301. And we're going to look at some posting requirements and deadlines. Some we've already talked about. And then finally, the C word, the dreaded C word that we've heard for a while. We're going to talk about COVID-19 in terms of record keeping, sort of what we need to do as a company if we have someone who has a work-related confirmed COVID-19 case. And notice I mentioned work-related and confirmed. So this is sort of what's going to guide our conversation today. So I want to start by giving you a little history and talk about why we keep records, a little bit of background. So why have a record keeping system? Well, record keeping is really just the cataloging and tracking of all of your work-related injuries and illnesses that occur throughout the year. So it's not only an OSHA requirement to track these injuries and illnesses, and again, that's for most people, but it is a great tool as well for employers to utilize in terms of tracking and outlining and trying to identify the causal factors in the actual injuries and illnesses on the log. Record keeping definitely can be confusing in terms of what needs to be recorded or not. And we know that. We've all had questions about it. And we get a bunch of emails during the year regarding the record keeping form in different scenarios. And we try to look at those, research them, and get an answer back. So feel free to always reach out to our group if you have those kind of questions. Also, because of the Occupational Safety and Health Act of 1970, which is, which drives all the OSHA enforcement and compliance, that's the OSHA Act of 1970. It requires that covered employers prepare and maintain records of occupational injuries and illnesses. So we know that OSHA, is in the U.S. Department of Labor. They're responsible for administering the record-keeping system established by the Act. And so that OSHA Act and the record-keeping regulations in 29 CFR, which would be 1904, which would be our recording and reporting occupational injuries and illnesses. And also in 1952, which is our approved state plan for enforcement of state standards. And roughly, give or take, there's about half of the states are run by state OSHA and half of them are federal. Of course, West Virginia is under the federal OSHA. And so, these standards provide the recording and the reporting requirements, which comprise the framework for the nationwide occupational safety and health recording system. So we need to know what's going on, and that's why we record these incidents. Now, roughly 20 years ago, OSHA issued a final rule revising the 1904 and 52 standards. And that was the first revision since 1978. So this was back in January of 2001. And their goal of the revision was to simplify the system, was to clarify ongoing concepts, was to reduce more useful information, and then better utilize modern technology like electronic databases and so on. So the new regulation took effect a long time ago, January 1st, 2002, and it added a couple things to it. And we know back in 2015, they added another section to it, or another requirement, and we'll talk about that. But what we're going to do next is talk about how do you comply with the OSHA's revised record-keeping standard. And again, as I mentioned earlier, all U.S. organizations, with a few exceptions, are required to comply with OSHA's record-keeping. So businesses need to record the following work-related incidents on this slide: death, missed day of work or missed next shift, restriction of work or transfer to another job, medical treatment beyond first aid, loss of consciousness, occupational illnesses. And there are 3 types of OSHA record-keeping forms that you can use and that you need to use if you're required. This would be the 300, 300A, and the 301. We're going to look at each of these so you'll get to see them. And also, I want to mention, I'm going to do this multiple times, like I mentioned in the beginning, we want to keep these records for 5 years. So if you don't have these records already, we need to go back and recreate them from our incident data, because I'm guessing most people keep injury records somewhere, and they probably have a pretty good idea. Maybe they've done some incident reports. If we can recreate those forms accurately, we want to have 5 years of data, and that's the requirement for that. So let's take another anonymous poll again. With everything else going on, we know record keeping can be challenging. So I'd just like to poll the group on what the one single biggest challenge is. So just select one of these for record keeping. I just want to look at, we'll give you a few seconds here to answer this. Again, it's anonymous. I'm getting some good data here. Okay, so with 75%, 78% of the vote in, it's really gone to that determining recordability of individual cases, sort of what we talked about in the beginning. That's probably the most difficult things for most people to do. I have a seizure. I have a worker who had a seizure, and we know that worker has epilepsy, and they fall while having a seizure and hit their head. Maybe they have a laceration that needs, or a gash that needs to be stitched up. And you start to think, is that recordable or not? And they can be real tricky. So thank you for that. And I was sort of guessing that recordability would be the big one. So, who has to complete the OSHA injury and illness record keeping forms? Well, as I mentioned at the start of the record keeping overview, all organizations in the US who fall under the OSHA Act of 1970 with some exceptions, are required to comply with that record keeping. Some of the exceptions are if you have 10 or fewer employees. So, 11 plus, we have to record or keep a log and fill out the forms, but less than that, we would be exempt. Luckily, OSHA has also provided a list of industries that are exempt. Industries like florists, clothing stores, gasoline stations, childcare services. These are the sort of the low hazard. Of course, if you're a high hazard industry, you have to keep records as well. So now I say they're exempt, but if OSHA requires them to submit for a specific year in writing, then they would be required to do that. The size exemption is based on the company's peak employment during the last calendar year. That's very important. So if any time during the last year, the company reached 11, maybe it was just for a month or two. If they have 11 or more workers, then the company is not size exempt. However, the company and some of its individual establishments may still be exempt because of the industry classification. So the size exemption is based on the number of employees in the entire company. And again, you would include, I'm sure people are wondering, temporary workers, the ones that you supervise on a day-to-day basis. You would have to include them in that count. It should also be noted that minor injuries requiring first aid require first aid only, they would not need to be recorded as well. And so what cases need to be recorded on the form? We know who needs to keep records, and we know what cases need to be recorded, but what about, we have to do any work-related injury or illness that meets a certain severity criteria has to be entered on the forms within 7 calendar days of learning about its occurrence. So we'll talk about each of these bulleted items on the next slides. We'll talk about injuries and illnesses first, and then we'll get into work-related and then meets a certain severity criteria. So the question of what is considered an injury or illness, and if you look into OSHA's definition, they define an injury or an illness as an abnormal condition or disorder. Injuries and illnesses include things like cuts and fractures and sprains and skin diseases and respiratory conditions. For OSHA record keeping purposes, an injury or an illness can also consist of only subjective symptoms such as aches or pains. So exposures that do not result in signs or symptoms are not considered injuries or illnesses and should therefore not be recorded on the OSHA forms. I mentioned this is confusing, right? So for example, if an employee is exposed to like chlorine and does not exhibit any signs or symptoms due to the exposure, the case would not be recorded on the log, even if it involved like prophylactic, that is preventative medical treatment, just a preventative treatment. So keep that in mind. And then we'll talk about what cases are work-related. Cases that are caused or contributed to or significantly aggravated, that's a big word, by events or exposures in the work environment are considered work-related as far as OSHA record-keeping purposes are concerned. So work-relatedness is presumed for injuries and illnesses occurring in the workplace or in locations where employees are located as a condition of their employment. So they could be somewhere else. It is then also important to remember that if work makes a contribution to the injury or illness, it is considered work-related. So there are certain activities, and I'll give you some examples, that occur in the work environment that OSHA does not consider work-related. So we think about injuries that result directly from eating, from drinking, preparing one's own food in the workplace. They would not be considered work-related. So they have a whole list of these activities in the standard that you could look at. And it may be worth looking at some of those at some point. So what are the severity criteria for recording a work-related injury or illness? Well, as I mentioned earlier, we have to work-related injuries and illnesses that result in death, loss of consciousness, days away from work, restricted work activity, transfer to another job, or a medical treatment beyond first aid. These things have to be recorded on the OSHA forms. So these are your severity criteria that need to be recorded. So just a real quick activity. Well, if you have like a thumbs up or you want to use the chat box, let's just think about, are these things medical treatment or not? So, the first one, would an employee who has an x-ray and it's found there are no broken bones, would that be considered medical treatment? Anybody have any thoughts? No. Okay, so somebody put no, that they would be correct. We got a couple no's here. That's good. What about an employee who receives a chiropractic treatment for a shoulder injury? Would that be considered medical treatment? And you're right, x-rays are not considered medical treatment, so that's good. Yes, okay, that's good. So you picked up on that. Let's see, we'll put a little check by that one. So what happens if the doctor cleans a cut with water and antiseptic and places a butterfly bandage over the wound? No. Okay. So we're getting a lot of no's there. What about employees that's prescribed 800 milligrams of ibuprofen? What about a prescription? Yes. Okay. So a lot of you are saying yes, and that would be correct on that one. The next one is, as a result of a compressed gas canister falling on an employee's foot, the toenail is drilled. So is drilling toenails to relieve blood that accumulated under the toenail, would that be considered medical treatment or first aid? Okay, so a lot of people are saying yes. All right. Employee is immobilized by a backboard in order to transport her to a hospital. What do you think about that one? Okay, so no, that'd be correct. And then a physician removes a wood splinter embedded in an employee's eye. And a lot of these, you're right, Jeremy, a lot of these we need more information, but definitely that last one would require or would be considered medical treatment. Now I'm getting these from the standard, and in the standard they list out all of the first aid, and they list specifically, drilling a nail to relieve pressure as first aid. So you can look at that first aid activity in the 1904 standard and see what is first aid. Everything else would be considered medical treatment. So thank you for participating in that. There's some other recording criteria. So we got work-related cases of cancer, chronic irreversible disease, fractures, cracked bones, those kind of things. Even a punctured eardrum has to be entered on the OSHA log. So these are really considered significant injuries and illnesses. And the record-keeping rule has some special criteria. And today we probably don't have time to go through all of these, but they have some special sections on the recording of occupational hearing loss, tuberculosis, bloodborne pathogens. So we're talking about injuries from needle sticks or sharps that are contaminated, and also medical removal. So if the person's removed from their job because of an exposure. Now we know that some standards have different testing levels in them, like formaldehyde and some other ones where you have to have medical monitoring, and you could be removed from that job because of that monitoring. So there's some other recording criteria that would be in that standard. So now that we know that we have to keep records and we sort of know which injuries and illnesses have to be kept, how do we decide if the injury or illness is recordable or not recordable? And maybe we don't know. So luckily, OSHA has provided in their standard a flow chart. And this sort of helps us decide if the injury or illness is recordable or not. So if we take a look at it and we said, did the employee experience an injury or illness? If it's no, then we don't have to record it. If it's yes, then you ask yourself if it's work-related. So if it's not work-related, then we would not record it. If it is, then you would ask, is the injury a new case? So if it's not a new case, we would go and update the previous injury. And if it is a new case, then does it meet the general recording criteria for that case? And then it's yes, it'd be recorded. If not, it's not recorded. So we'll talk briefly about some of these things. So let's jump back. We're going to talk about 2015. OSHA added another section about reporting severe injuries. And hopefully everybody knows this, but as of January 1st, 15, all employers under OSHA's jurisdiction has to report these incidents to OSHA. Even employers who are exempt from routinely keeping OSHA records due to the company size or industry. So we have a worker who's injured, and these are like 4 diamonds going across. They don't keep falling on each other. It's just, was the injury fatal? Unfortunately, sometimes injuries are fatal. So if you have a fatality at your workplace, we have to call OSHA. And we sort of had to do that before, but we have to call them within 8 hours. We can call the nearest office. We can call the OSHA 24-hour hotline if that nearest office is not open. We can report online. So there's different ways we can do that. But if that worker was injured and maybe they were admitted to the hospital, and this means they're in the hospital, right? So if they're admitted, then that means you'd have to report to OSHA in 24 hours. We used to have to do this for 3 or more. Now, after 2015, if it's one person that's admitted, then we have to report that to OSHA within 24 hours. And again, OSHA defines that inpatient hospitalization as a formal admission to the inpatient service. So we're not talking about, treatment in the emergency room only, right? And then if you have an amputation, like if you have a worker who's hurt and they have an amputation, and the amputation is just a loss or part of a limb, right? Or a body part. So it could just be your fingertip amputation with or without bone loss, right? And OSHA defines that. And again, you'd have to call OSHA if you had a worker. Obviously, all these folks are going to go to the emergency room, but we have to call OSHA if you have an amputation. Then finally, if you have a worker who loses an eye as a result of a work-related injury or illness or injury, we would need to call OSHA within 24 hours. So this is sort of a new thing. It's 2015, but there's still a lot of companies that we run into that have had some of these injuries, and maybe they haven't called. So it's really important to be aware of this. And again, if that office is closed when you go to call, don't leave a message on the answer machine. Call that 800 number to report that. So let's talk about what are you going to report? You're going to talk about the establishment name. So you'll give your name of the company. You'll give the location, the time when it happened, the type of reportable event, whether it's an inpatient hospitalization, a fatality, an amputation, or a loss of an eye. You give the number of employees who suffered that event and the names of persons, contact person, phone number, and a brief description. So you're giving OSHA a lot of information here, and they're probably going to follow up on it, most likely. So in the next section, we're going to actually see these forms, and 300, 300A, and 301. I'm going to hit the highlights of each form. These are available online. I could even put a link into the text box here in a little bit. And the first thing is, what forms have to be completed? And I've mentioned this already. There are 3 forms that you have to complete if you're required. Again, 300, 301, these are going to be maintained on an ongoing basis. The 300 is just your log of work-related injuries or illnesses. So you'll start out with 1, 2, 3, and keep adding to it all year long. Of course, the 301 is just an incident report. You're probably already doing that anyway. And so for each log that you enter, you have to do an incident report. And the OSHA Form 300A is completed at the end of the year. So you might have done this in January or February, or really prior to February, because we're going to post that 300A. So you would probably do that after the year, so probably in January, and you'd summarize all the recordable cases that occurred. So you can use the equivalent of all of these forms if you want. As long as they have the same elements and the data is there that OSHA wants, you can have your own form, especially the incident report form, the 301. So here's an example of the 300. Let me see if I can make that a little bit bigger. And this comes right off of OSHA's webpage. They have it now where you can fill it out electronically, and you can see the screenshot shows that. But this form really provides the log information for each incident. So we're going to have the case number. You'd start with number 1, right? You'd have the name of the employee, the job title, the date of the incident, where the event occurred, the description of the event, which would include the parts of the body, the object, the substance that directly injured the employee. Again, some of these cases could be a privacy case depending on what happened. So you might have like a little exception for that. You might have a little code that you keep the name with a number and be able to sort of keep the name off the sheet. You have to classify the incident in the step 3. And so it's either going to be a death or missed or restricted or other. And then you have to count the restricted or missed days in step 4, and then select the injury type or illness type. So it's either an injury, a skin disorder, a respiratory poisoning, hearing loss, are there in that section. So you notice down at the bottom, you can sum these up and they have little numbers by them. Well, that all transfers to the annual summary to make it a little bit easier to fill out. I want to talk about counting days on the Form 300. We're using total days of work missed, total calendar days, right? So we're not counting the day on which the injury occurred. And then if you have a partial day, except for the day of the injury, you're going to count that as a full day. Used to be, if you're on vacation or your weekend, we didn't count it. But now that we have to count every day, right? Calendar day, every day after the event, the day after the event. The good news is we're going to cap that restricted or missed days at 180 on the logs. Even if the actual time is greater, we're going to cap it at 180. Privacy cases, I didn't mention this. We don't want to enter the employee's name on the log. We want to keep a separate confidential list of case numbers, right? And employee names, and put those case numbers on the log so that no one knows that employee's name isn't shown on that log. So we want to use discretion in describing the injury or illness as well. So these are some of the things that you probably want to have a privacy case, a bloodborne pathogens exposure, an incident to an intimate body part, or reproductive system, or mental illness, or things that might be embarrassing, even bloodborne pathogens and stuff like that. It's sort of things you want to keep private, and you have to do that. The Form 300A is our summary. This is our summary of the injuries and illnesses for that year. And we want to verify the completed log, make sure it's accurate, and then use this form to do our summary on. So on the right side of the form, you will see the establishment information. And you have to fill out and pull off of the log all these different numbers. And how many poisonings, how many hearing loss, and those kind of things. This is what gets posted in February to April. This is what also gets submitted to OSHA if they request in writing for this. So you write the totals on the left side of the form and make sure you add entries for every page of the log. You might have multiple pages of that 300 log. You also, if you have 0 cases, which a lot of companies do, you still need to post this, and you still need to put 0 basically in there, showing that you posted it, and let your workers see this form. One of the big things that I see when I'm out in companies, and I've seen this cited and I've seen it personally as well, is the signature line. If you notice down there, it says the company executive. And so under the OSHA's rule, a company executive can be one of the following, and they list out the owner of the company, only if the company has the sole proprietorship or a partnership. They list out an officer of the corporation, the highest ranking company official working at the establishment, and the immediate supervisor of that highest ranking company official. So not just anybody can sign this log. And I've seen different signatures on there that weren't part of this executive team, and they were cited. So it's something to keep in mind. That signature is certifying that those OSHA Log 300 form summaries are correct. And this is what you're reporting. Here's the 300A form just blown up here. Make it a little bit bigger now. Again, it's a summary. So first through the 30th, I mentioned about the company executive already. You're going to put your North American Industrial Classification Code, number of employees, total number worked by employees, and so, or hours worked by employees. All that gets filled out. This is what you would post. As far as the 301, this form basically provides a detail about each incident. It's an incident report, right? It needs to be completed within 7 days. So I'd remember 7, right? Of receiving information about an injury or illness. So you could use your incident report form as long as it has all the information that is on this form. And you have to fill out the injury and illness incident report. Again, for every one of those log entries that you have, you should have one of these sheets backing it up. 7 days, remember that number. So you have some time to look at it. So there it is, just sort of blown up. The key points on this 301, you have all the name and address and gender and date of birth and date hired, that kind of stuff. You have the physician and healthcare information. whether they had an emergency treatment facility physician. And then you have all the information that needs to be captured, like the case number, the date of the incident, what happened prior to the incident, what happened during the incident, the date of death. And so all this has to be captured on this form. You can do it electronically, and that's fine as well. So you got to keep these 3 forms on file. And I mentioned this will be the 3rd time, right? 5 years prior, following the year which they pertain. So you have to have 5 years of these forms. You also have to update the form 300 if there are any changes that may occur to the recorded cases during that period of time. So you might have to go back 5 years if there's still a recordable, a change in that log. Again, you never send these completed copies to OSHA unless requested. They want the 300A. But sometimes if OSHA comes on site, or maybe you have a union or an employee, they can all request to see these forms. And let's see what else. I think that's it for that. So just always remember access to the records. We have to allow access. I want to take another anonymous poll, and just to see how many on this webinar have to submit a 300A form electronically. That means you had a written letter sent to you saying that we want your data on the 300A form. Just to see here how many. And we have about 61 people on the call today. And a lot of you.
John, while that's coming up, we had a question from Brett Black about the forms. I thought we might go ahead and answer that while this is being filled out.
Okay.
Yeah, he was curious about on the 300 form, if you have a case where they're days away from work and then they eventually come back to light duty, do we choose days away or restricted? He said you can only choose one of them on the form, and he assumed it was the days away.
Yeah, that's a good question. So this would be like basically how do you count like the restricted work activity and the days away? Is that what you're asking?
Yeah, he says, do you choose the days away or the restricted?
Okay, so with that, you want to count the calendar days the employee was on restricted work activity or was away from the work. I'm reading this from this question answer. One of the the good things about the standard is the new standard. When I say new, 2002, they wrote it in a question answer format, and they actually have that question. How do you count the number of days of restricted work activity or the number of days away from work? And I'm not sure this is going to answer your question, but I have some other examples at the end. But it says to count the number of calendar days the employee was on a restricted work activity or away from the work as a result of the recordable injury or illness. Do not count the day on which the injury or illness occurred in this number, and then begin counting days from the day after the incident occurred. If the single injury or illness involves both days away from work and days of restricted work activity, you want to enter the total number of days for each. You may stop counting days of restricted work activity for days away from work once the totals of either or the combination of both reaches 180 days. Now that sounds like that contradicts what you're reading on the form. Let me look at the 300 form. So it has a box here. It says enter the number of days the injured or ill worker was away from work or on the job transfer. It would be in step 4. I don't know if that answers your question or not, but you would list. So if I was off for 5 days and then I came back and I was on restricted for 2, we would list that on each of those columns. I'm not sure if that is what you're asking.
Yeah.
Okay.
I didn't mean to derail you there.
Yeah, no, that's a really good question. And like I mentioned in the beginning, I always sort of want to peek at the regulation because there's so many things variables, I guess, that are playing a role here. It's hard to always answer a question right away. But at any rate, we can see that over half of the group here, or we got about 52% are required to submit the 300A form electronically. And a lot of companies, you do see they're preparing that. So out of that group, I'm going to ask another poll here in a little bit. So we'll keep that in mind. So I'm going to talk about the electronic submission for those of you who are required to submit the 300A form. data. And again, this is for people, over 250 workers, or if I'm in a high risk industry with 20 to 249 workers, I'm required to submit this information. And here's the electronic submission. So if we're looking for the submission year, which is right now 2021, we would be submitting our 2020 calendar year data, and our deadline was 2 days ago. Now, if you haven't done it, I would suggest doing that by the end of the week and get that data in if you're required to do that. All right, so here's the other follow-up to that poll that we said roughly 50% of you have to do this electronically. And, go ahead and give this one a shot. So if you answer yes, did you already do it? Is what we're asking. It looks like a couple of you maybe haven't, but the majority have. So if you're required and you didn't submit it, again, I'd say by Friday to get your summary of the 300A, and it's online. You can submit it at OSHA's website, and I'd go ahead and submit that data. Okay, so 75% of you have already submitted that. That's good. All right, let me see if I can move along here. This is another confusing section, and companies call, and I get this question a lot because it's new, right? And it's a little different than what OSHA has done with influenza, like the seasonal flu in the past, or colds. So we're going to talk about this, and this will be the last section that we're going to address. We're going to talk about OSHA reporting in COVID-19. Again, it's familiar, I will tell you that, because it's the same as any other injury or illness recording criteria. Except the case, this is the big one that I was talking about in the beginning, the case has to be confirmed as work-related. And so that part is probably the most complicated part, is the confirmed case, and it was work-related. So I'll try to give you some information on how OSHA is looking at recording COVID-19 cases. And again, when you're recording these cases, it's either going to be your medical treatment beyond first aid, it's going to be restricted work, or a lot of times it's just days away from work. It's lost time because the person may be out for 5 days or so because of the COVID-19 illness. And so you see these three things are or, and then it's and it says the illness is confirmed case of COVID-19. And the case has been determined to be work-related. So it has to be work-related, and it has to be a confirmed COVID-19, not a suspected, but a confirmed. So let me talk about confirmed a little bit more, or in more detail, I guess. So a confirmed case of COVID-19 means an individual with at least one respiratory specimen that tested positive for the SARS-CoV-2 virus, that's the virus that causes COVID-19. It has to be at least one specimen tested positive. OSHA is not going to consider a suspected but unconfirmed COVID-19 case to be recordable. And they cite the Center of Disease Control guidance. So what does this mean? Well, it means that if you have an employee who's off work due to an expected case with possible exposure, it will not be recordable. It will not be a recordable case, I should say, until they have been tested and confirmed positive. So once you're tested positive, then it would become recordable. So this is days away from work in most cases, like I mentioned. And it's a respiratory case on the OSHA log. So when you check off days away from work and you put in that amount, you're going to also check off in the last section, step 5, as a respiratory case from having COVID-19. Now, a lot of folks are probably thinking, well, how does COVID-19 and work-relatedness play into this? And this is another, again, sort of confusing area, but it's up to the employer to put in good faith to determine this. So determining that work-relatedness is critical, and assessing whether that employee, the employer has made a reasonable determination is what the OSHA compliance officer may do. So they're gonna look at the reasonableness of the employee's or the employer's investigation into the work-relatedness. So it's not just, it's not work-relatedness. You have to have some data behind it and explain why, and that's what they're going to rely on. So given some of these privacy concerns with workers and the HIPAA rules and that kind of stuff, it would probably be sufficient in most circumstances for an employer to ask how do you believe you contracted COVID-19? So to ask an employee, how do you believe you contracted it? Maybe ask them, to discuss the work and out of work activities that may have led to the illness. And then finally, to review that employee's work environment for potential exposure sources. So that would be a big one as well. If you have a whole department that it's spreading in and there's no other real, that would be something to look at, I guess, as a potential exposure. So that evidence for COVID-19 illness to be contracted at work, it might be, for example, if the number of cases developed among an employees who work closely together without an alternative explanation, they're not getting it from a family member or Food Lion or Walmart or any other company, you might say it's work related. So again, this is up to the company to decide, but what they want to see is that you've put in some good faith and that you've tried to figure it out if it's work related or not. So as far as enforcement's concerned, and you can see the number there, it's a lot. So since the start of the coronavirus pandemic, this data was through the end of December. So this would have been, a whole, that time frame, December 31st or prior. OSHA issued citations from 300 inspections for violating the coronavirus, violations resulting to the relating to the coronavirus, I should say. Proposed penalties almost $4 million. So it's a lot. Now these violations, if you look down through them, they include failing to record an injury or illness on an OSHA record keeping form, failing to report an injury, illness, or fatality. Again, maybe you get COVID-19 and you're hospitalized. You might have to call in that severe reporting, as we mentioned in the beginning, within 24 hours. So, that's that inpatient hospitalization that you're seeing on this slide. And I want to talk about that a little bit more. An inpatient hospitalization has to be reported to OSHA when they occur. Within 24 hours of that exposure to COVID-19, that work-related exposures. So inpatient hospitalization is just when an employee receives a formal admission to an inpatient service of a hospital or a clinic for care and treatment. It's not for diagnostic testing, like someone mentioned in the beginning. It's not merely for observation. It's a formal admission. So, we'd have to call within 24 hours of learning that. And also fatality. Unfortunately, fatality due to the COVID-19 has to be reported if it occurs within 30 days of that work-related exposure to COVID-19. So, you got to sort of look at all this, and the employer also has to report the fatality to OSHA within 8 hours. That falls under that other stuff where the employee has died, and you got to make sure that death was work-related and it was a positive case of COVID-19. So a lot of stuff I just threw at you, but in conclusion, the webinar reviewed OSHA's injury and illness record keeping requirements. And again, it was at a high level, but we looked at the record keeping standard background, looked at how to comply with OSHA's record keeping standard, looked at the different types of forms that you are responsible to maintain, the posting requirements, the OSHA reporting and COVID-19 we just discussed. So keep in mind that the record keeping page that's in this URL includes links to reference documents that will have specifics on the record keeping rule. And feel free to reach out as well to me and my team, and any of us, we can try to provide some guidance on these questions. If you have anything specific, you can go to this OSHA's question and answer search page. And again, you can get all kinds of scenarios here on record keeping. That's probably too much for today's webinar. But I would like to thank you all for joining us. Again, don't hesitate to contact anybody on the industrial extension team. I got, about 9 minutes left. I might just throw up some of these scenarios just to let you see the ins and outs of record keeping. Let's see about this one.
We're going to continue to record. So it'll all be recorded, and people can pick these up. We'll send the recording out to everybody. So we're certainly going to be respectful of people's times. But I think this is great stuff on here, John. So go ahead.
Yeah, and I don't, this is a lot of information I'm throwing up now, but I wanted you to just quickly see it. And maybe we'll go through as many as we can. I think I have maybe 4 of these, just to give you a flavor of the record keeping and what it looks like, read this scenario. I mean, everybody can see this on their screen, hopefully. And this is an employee who reported to work, needs to report by work, by 8 a.m. They drove to the company parking lot, 7:30 a.m., parked their car. They got out of the car and proceeded to the office to report work. The parking lot and the sidewalk that they were in was privately owned by the facility. The employee stepped onto the sidewalk and slipped on the ice and snow, and they suffered a back injury and missed multiple days of work. So they were days away. This company believed that the employee was still in the process of the commute to work. And so they said it, they said it was not recordable. Now I'm looking at the chat here. Let me open this up again. Where did it go? Chat. All right, so I'm seeing a lot of recordable. JR is saying recordable. Anthony, James, and you would be correct on that. Why is that? Let's take a look. The company parking lots and sidewalks are part of the employer's establishment for the record keeping purposes. So when it's snowing and it's icy out, we need to make sure that we take care of those spots. We had somebody who slipped on the sidewalk while walking to the office to report work, so definitely work related. And think about if the worker, let me throw one more at you. What if the worker was getting out of a truck and slipped on the side rail of the truck and then fell to the ground and had a laceration or a gash that needed stitches? That's not recordable, right? Think about that one. Let me, and I'm just throwing that one out there, but let me look at this one here, because you guys are answering these pretty quick. An employee reports to work. Several hours later, the employee goes outside for a smoke break, right? A lot of people do this. The employee slips on the ice and injures his back. Since the employee was not performing a task related to the employee's work, the company deemed this incident non-work related and therefore not recordable. What does everyone think on that one? Maybe put it in a check box or chat box. Do you think they're correct in that? Do you agree or disagree with what the company said? So you guys are saying it's recordable. Jeremy Ellis says it's recordable. So definitely. And why is it recordable? Anybody know why this is recordable? Maybe want to put that in the chat box. Well, let's look at it. I wrote up a little thing here. So this is what OSHA said. An injury or illness is not work related if it is solely the result of an employee doing personal tasks, so unrelated to their employment at the establishment, outside of the employee's assigned working hours. So in order for this exception to apply, the case must meet both of the stated conditions. The exception does not apply here because the injury or illness occurred within normal working hours. Therefore, the case in question is work related. So all of you were correct, and it meets the general recording criteria. So good job on that one. I'll give you another scenario. I mean, I'm sure some of you have had all these scenarios happen at your company. So an employee drives into a company parking lot at 7:30, gets out of the car, goes across the parking lot to clock in to work. When a second employee, also on the way to work, approaches the first employee, and the two employees get in a fight right in the parking lot. So one breaks an arm during the fight, and the employee goes to the doctor. Of course, they get medical treatment. Key word there. But the company said it's not work related and therefore not recordable since the employees had not yet reported to work, right? Or the work test was not being performed at the time of the fight. Do you agree or disagree? Okay, it's work related because it happened within the assigned working hours. Chris Chambers, okay, so that's good. Record keeping regulation contains no general exceptions for the purposes of determining work relationship for cases involving acts of violence in the work environment. So a company's parking lot and the roads are part of that employer's premises, and therefore part of the employer's establishment. So whether the employee had not clocked into work doesn't really affect the outcome. So the case is recordable, and you're correct on the OSHA log because the injury meets a general recording criteria. And the last one I'll leave you with, I'm going through these somewhat quick because of the time, but check this one out here. We got a lot of temporary workers at a plant. 3 of those workers, those temp workers, were injured. They each received injuries that were recordable on an OSHA 300 log, and the employees were under the direct supervision of the site. That's a key point. So is it correct that these injuries were recordable on the site log, or should they have been recordable on the temp agency log? And what are the criteria related to the temporary workers that need to be reviewed? So what do you think about this one? Would you agree that they should be on the OSHA log for that company or not? And you guys are saying the site log, and that's exactly right. Again, the key point here is employees under the direct supervision of the site. So this can get a little tricky, but you're exactly right. So, and there it is. The response from OSHA was the employer must record the injuries and illnesses that occur to employees not on its payroll if it supervises them on a day-to-day basis. And you can read the rest there. So it would be recordable. All right. So we ran through those, and I'm trying to get finished here right on time. But are there any questions? Any comments? You can put them in the chat box. You can feel free to email me because I'm sure there's a lot of questions and a lot of scenarios that we could probably look at. But there's my email. If anybody wants to send a specific question, we get them all the time. Go ahead, Jamie.
Yeah, there were a few that came up during the thing. I think you answered some of these, but who counts temp agency workers was one from Nancy Brown.
Who counts? So if the temp worker is under, even if these temporary workers, if they're under your direct supervision, is my understanding that they would be counted. And even on the, and maybe you're asking about the like 10 or more or 11 or more workers, they would also be included on that as well. I don't know if that answers that question or not, if that's what you were looking at.
Yeah. And Cynthia's asked a couple of questions about remote employees. Are they counted in the employee count?
Yes, they are. If this would be, and I guess what you're asking, Cynthia, is, I'm here at my office, and now I'm going to go out to do a sales call. Maybe I'm selling stuff, and I drive somewhere else, and I spend the night, and that evening I go out to dinner. I'm at a remote location from my office, but I'm still doing work-related, I'm working in the interest of my employer by going out to dinner with maybe a potential client. So you look at the work relatedness, and again, I'm not sure if that exactly answers your question, but it's, okay, you have clerical remote employees. So is this sort of, I'm looking at your chat. So is this like now with COVID-19 that we're sort of remote? Is that what we're getting at?
Yeah, that's what I'm.
That's a good question, and I, feel free for anybody to chime in on that. If you know that answer and you can chime in, that would be great too. But yeah, so I'm trying to see if there's any guidance in this one. I might have to get back to you on that. Again, if they're working as at home, they really don't control things at home. But if you're hurt while working as part in the interest of your employer, then yes, it would be. So, and Veronica, yes, if working in the course of doing work, that's exactly right. So, yeah, it's always what were you doing at the time of the incident, and was it in the interest of the employer? So we put, if you're feeding the dog, no, that's a good example. Thank you. Any other questions? Really, we should have another one of these that just answer questions. And have some maybe other people on here who really know this stuff well. It takes a lot of knowledge to get these questions answered. There's just so many variables and scenarios out there, and I've seen a bunch of them. And after you look at them, it all goes back to, was it work related? And was it in the interest of the employer? And if you're at a hotel and you're spending the night, that's sort of what you would have been doing at home. So no, it wouldn't. But anyway, any others out there, Jamie? Or
yeah, I saw one here, and hopefully Douglas is still with us. Do you need to submit if you have no work-related injury? So if you have
Okay, so yeah, that's a good question. If you're required to keep the records and you have 0, then you put 0 on that 300-day form and you post it in the workplace where employees congregate from February to April. And if the OSHA in writing requests that you submit the 300-day data, then yes, you would still want to submit that as 0. And that would be great. Yeah, how do you line out if you enter a mistake in the log? That's a good question, Nancy. Because sometimes we don't want to erase, right? We want to strike out and line out. And so you would just strike that and then you might strike it and write it below it. But you'd not want to erase it. You would not want to remove it. And I know they have, a thing there that you can definitely, because things change. Maybe initially you put it on your log, and definitely OSHA will never, they're not going to look at you bad if you put things on the log that shouldn't be there. But sometimes the situation changes after you think about it, and you have to strike that and then remove that person. So you just want to strike through it if you make a mistake on that log.
Okay. Yeah, and Brett asked, what's the best way to contact us? And you see John's contact information right up there. You can also visit wvmep.com to find all of our contact information. And yeah, we pride ourselves on being very accessible and happy to help in any way we can. So yeah, we try really hard not to make these a commercial. We try to make them informative, and I think John did a great job of that. But I think it kind of shows the depth of knowledge. And we've got Greg Green that also handles industrial hygiene and occupational safety and health with us as well. So yeah, those two together should be able to come up with questions or answers to just about any of your questions.
Okay. Well, thank everyone for attending today, and that puts us a little bit after time. So guess we'll leave it at that.
Yeah, thanks so much, John.
Yeah.
Great stuff. And we will be sending a recording out in the next week. And don't forget creating a process map next Thursday. Go ahead and register for that if you can. So thank you, everybody.